So I'm going to very briefly talk about medical apartheid and COVID-19 infections in Israel, Palestine. I've been doing a weekly COVID-19 timeline since the beginning of the pandemic. And if you want more information, it's all on jvphealth.org. So if you look at these two graphs, on the horizontal line is the dates and the vertical line is the cases. The blue line on the top left graph is cases in Israel. And you can see they had their first wave, and then they had their second wave, and now they're leveling off. The red line is the West Bank, and again, it's not as obvious because the numbers are lower, but there have been several waves, and now there's a spike in the West Bank. If we pull out the Gaza numbers in the right lower quadrant, you can see that Gaza was very successful at preventing the entry of COVID into the Strip, but that all fell apart in August when community spread started, and then it had rapidly accelerated to an almost steady rise, slowed down a little bit, and is now going up again. Next. So why is the Israeli response to COVID-19 an example of medical apartheid? So I think first you need to remember that Israel is a first world country, top-notch healthcare, universal healthcare access, and they struck a deal very early on with Pfizer to get all the vaccine they needed quickly in exchange for a large amount of money. And what many are reporting is rampant violations of medical privacy. This has been aided by a lot of whitewashing in the media. So they've had a, quote, successful vaccine rollout to their citizens. And this is despite major obstacles reaching Palestinian citizens for all the racist and social reasons you can imagine, and reaching ultra-Orthodox Jews who basically don't believe in science. The R number refers to the number of people infected after one person gets infected. And this slide I made last week, as of this week, the R number is 0.55, which means that if someone in Israel gets infected, they infect half a person. So they're doing really well. Now, while that's going on, right next door in the West Bank and Gaza, there's a severe occupation and siege. So first of all, the baseline reality is totally different. And if you think about it, in Gaza, where 95% of the water is polluted and people live in extreme crowding already, that's not conducive to controlling pandemic. And then there's all the medical issues, constant shortages of test kits, medications, ventilators, oxygen, et cetera. So with the Oslo Accords, Israel maintains that with the Oslo Accords, it states that the Palestinian Authority is responsible for healthcare in the territories. However, the Geneva Accords, which is an international accord, predates Oslo and actually takes precedence, and it mandates that the occupying power is to apply the prophylactic and preventive measures necessary to combat the spread of infectious disease. And so the international community is saying you've got to go by the Geneva Accords. But what Israel wants is for Palestinians in the territories to have the responsibilities of sovereignty, providing healthcare, without the benefits of sovereignty, which is resources and control over the system, which means that the response to a pandemic depends on your geographic, ethnic, political status, which is an obvious example of apartheid. Next. So the big issues are who's responsible for vaccinating occupied Palestinians, Palestinians in the Israeli prison system, and Palestinian workers in Israel and the settlements. As of now, only the third category has received a vaccine from Israel, and they thought of it as a charity as opposed to an obligation. And Palestinian authorities have been left basically scrambling for doses all over the world and from an international consortium called COVAX. And an example of how crazy this is that Netanyahu recently suggested sending vaccine to countries who've moved their embassies to Jerusalem, Honduras and Guatemala, the ones that got vaccines. And then this program was canceled when people were outraged. So there's a lot of vaccine washing, politicization of who gets vaccine. And all this is going on while there's a spike in the West Bank and rising numbers in Gaza. So Israel has both the moral question of it is immoral for them to have all these vaccines and not share, the legal international question, and then their self-interest, because having rising numbers in the occupied territories only puts Israel at risk for more infection and for the development of variants. Next. In terms of the US response, there have been a bunch of campaigns with growing pressure on Congress. 3 letters have come out of Congress. One was in the Senate, signed by some of the usual suspects, and 2 were in the House, basically calling on Secretary of State Blinken to tell Netanyahu to provide vaccine. And as Ray mentioned, there have been no Washington signers. And just particularly looking at the third letter, which came out there were 17 House members that signed calling for continued pressure on Israel to meet its obligations under international law as an occupying power to vaccinate Palestinians living under its control. And this was led by Mark Pocan from the Congressional Progressive Caucus, and then a Muslim American, and then the usual suspects. And then under the pressure to play catch up on the vaccine diplomacy scene, Biden has said that he'll help finance vaccine manufacturing, but he's just not going to share any exports of the enormous excess numbers of doses that we have. And the sharing is going to be through something called the Quad Summit, which is a virtual meeting of leaders in the US, India, Australia, and Japan. And they've all committed to provide financial support to a major vaccine manufacturer in India, who has said they're going to produce 1 billion doses of coronavirus vaccine by the end of 2022. And that is COVID-19 and Israel-Palestine on speed.